would like to share with you a way to self-mobilize, so around your home, office, or even in your gym, the anterior medial hip complex dominantly. Now obviously, when you look at anatomy, we function as a whole and anatomically we're a whole. But depending on the position and depending on how force affects our body in that position will depend on how much stress we place along different regions. So regionally speaking, what we're doing here is placing a force, a stress if you will, across the anterior lateral part, the anterior medial part of the left hip complex. The reason why I have this model is to share with you variations and how it has an effect on the down leg. So my right leg is going to be put up on this block, and I'll go through the exact demonstration in a second. As that right hip is flexed, the femur on the pelvis, it has a direct influence on the extension of the left side. Therefore, the variables here have to do with the height, the step height on the front. So if you don't feel it or you feel like you're not getting good results, chronically speaking, then use your variable of height to change the intensity of the back leg. Once the back leg is set, we can keep it set. It's the variable in the front that will determine how much intensity you get on the tissue matrix on the left-hand side. Allow me to demonstrate. So the first thing you want to do is a couple props around your house. When we're at home, oftentimes we don't have this nice adjustable step that you see here in our clinic, and we don't have this beautiful cage at home. But what we do have is a doorway, and we have a foot step stool that works really well for our individuality. I know some people, they actually have multiple step stools, and they use different steps, or they'll use books. Whatever you think is good for your individuality, you're going to have to apply it and figure out what's best. The first thing you do is you place your right foot. Again, we're going to emphasize the tissue complex on the left. So you put your right foot up on the step, you hold on to your wall or doorway, and then your left side, in a very relaxed manner, is going to go up on a step or a few books, just enough so it's not on the floor. What that does is it creates knee flexion on the left side. And as you can see here in the video, I'm kneeling on a nice cushioned pad. That's critical. There's inherent compression of your knee into the floor. So that's not going to feel good. You want a nice cushioned pad. And I've been doing this for about 20 years now. My oldest client is 91. I work with a lot of 70-year-olds, and they have a lot of osteoarthritis, and they're able to do this. You just have to find the right environment. That's why the doorway works very, very well. So this is for all ages, is the point. So once I'm in position, what you don't want to do is just lean forward. Instead, what you want to do is elongate your body. Our goal here is to get the rib cage separated from the pelvis as a metaphor. We're trying to elongate, think of that, the pelvis from the rib cage, elongate the tissue from A to B, as I'm demonstrating with my hands. So you're on your wall, or on the inside of the wall of the doorway. What you're going to do is take a deep breath in, very, 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 very deep. Do that about 3 times to set yourself. Then, holding on with the right side, take your left hand. And I like to use the elbow as a tattletale. If the elbow's bent, that means you're not getting enough tension. Straighten your elbow. Think of your hands lifting to the sky as high as possible. And what you should feel is more elongation through the chest wall, down to the abdominal wall. And oftentimes, it'll increase the intensity down the left hip complex. So we're going to go up as high as possible. Take some nice deep breaths. Now once you've done that, you're going to progress into the lateral plane. So we go right lateral, we go left lateral. Right lateral, left lateral. Then you can progress to right rotation and left rotation. So here I go into right rotation, and then I can go into left rotation like that. So I'm opening my body up. Anytime I change the trunk mass, it has an influence on the hip complex due to the pre-stretched position. So we're literally using our body weight to mobilize our left hip complex, as well as the position of the right leg. I'd like to show you the next progression. After you've gone lateral in rotation, try to lift up a little bit higher and then migrate backwards. The key with the backwards is it shouldn't come out of the low back. Instead, what's happening is the pelvis actually shifts or translates in an anterior direction, and what you feel is a little bit more intensity right here. Now, if you want to get a little bit more medial, so anterior medial, what you do is you spread your legs apart a little bit. And what we can do then is we can use the right hand up as high as possible, and it goes to the left. And what that does, it tilts your mass, the body reacts, and you'll get a little bit more stress on the inside of the left hip that way. If I want to get a little bit more on the lateral side, I bring my feet in a little closer. So narrow versus wide. I go up, and I get that left hip bone to go out a little bit farther than when we started. So those are some variations. There are many more. Stay tuned with us, and we'll share with you a whole bunch of mobilizations where you can self-manage your connective tissue.